Hey friends, my name is Nicole and I'm happy to have you back for another Blueprint Nursing NCLEX review. Today we're going to talk about strains and sprains. Let's get into it. To start us off, we're going to talk about the pathophysiology of strains and sprains. We know that strains and sprains are injuries to soft tissue from excessive stretching or stress, right? Right. But what is the difference between a strain and a sprain? Well, a strain is injury to muscle or tendon, while a sprain is injury to a ligament. There are three grades of strain or sprain injury that rank from grade 1, no tear with minimal swelling, grade 2, partial tear of tissue, to grade 3, complete tear of tissue. I always think hearing examples helps the material stick better in my brain. So let's talk about the context in which you've probably heard of strains or sprains before. You may have heard a client having a sprained ankle where the injury occurs to the ligaments around the ankle. You may have also heard of a client who had a strained or pulled hamstring where the hamstring muscle is overstretched from activity. Strain is injury to muscle, sprain is injury to ligament. Let's talk about how clients with strains or sprains present. As a nurse, how is this assessed? Well, the client will report acute pain. Maybe there's some swelling present on assessment. What else? Well, they'll have some difficulty moving the affected limb. Onto the risk factors. What are you thinking may be a potential risk factor here? I'm thinking something related to activity for sure. Let's see. Our clients with strains or sprains will likely have experienced trauma related to sports or motor vehicle collisions. Lastly, our client with a strain or sprain may have just started a new sport, exercise, or activity. These are pretty straightforward, but they're good to review. You may see the provider order x-rays to rule out fractures and MRIs for clients with persistent or severe symptoms. Okay, we've talked about the patho, signs and symptoms, and risk factors. Why don't we head on to management and our nursing interventions? Okay, let's talk client education. With tissue injuries, we'll want to teach our clients about RICE. Do you remember what this stands for? Rest, ice, compression, and elevation. What is a little tidbit that you'd want to add when providing education about RICE? Well, we'll want the client to protect their skin when icing the affected area, so we'll tell them to use a towel between the skin and the ice. If clients are prescribed with an NSAID, what education would you want to provide? We definitely want to instruct our clients to take their NSAID with or after meals to lessen GI upset. Lastly, we want to give our clients tools to prevent injury. This may look like collaborating with a physical therapist to find exercise modifications or a reduction of labor-intensive activities. For suspected musculoskeletal injuries, we want to be sure to minimize the movement of the affected area. Okay, on to management. For suspected musculoskeletal injuries, we want to be sure to minimize the movement of the affected area. For cases of strains and sprains, it's better to assume the injury is a fracture until the x-rays show otherwise. Once diagnosed, we'll want to perform neurovascular assessments distal to the injured area. Remember, distal is further away from the point of reference, so a finger is distal to an elbow. It's easy to get distal and proximal mixed up, so I like to think that the dist in distal means distance. Using the 6 Ps of neurovascular assessment is a great way to adequately assess our client's circulation, movement, and sensation. Can you remember the 6 Ps? Pause here and see how many you get. Ready to name the 6 Ps? We've got pain. You practice your regular pain assessment here. Pallor, what's their skin color? Is it pale in comparison to the surrounding area or limb? Paresthesia, is there a tingling sensation? Pulses, comparing pulse strength above and below the affected area. Poikilothermia, is there an inability to regulate temperature? Is the distal limb cool to touch? Paralysis, what's the client's range of motion at or around the affected area? There are a lot of P's to remember here, but if you forget or stumble on this assessment, walk yourself through it. What have you assessed? Did you check sensation? Or try to group them together. For example, if I'm assessing pulses, I may also link assessing paresthesia and poikilothermia in there since I'm already touching the client. It's really good to go over these because in some way, shape, or form, the 6 Ps will show up on your NCLEX. Outside of the 6 Ps, we can expect the provider to place orders, like NSAIDs, for pain management. Besides assessment and pain relief, these clients will likely use physical therapy to aid in the healing process. As far as concerns or complications related to strains and sprains go, we know that pain or discomfort would be expected. But can you think of anything else we might want to keep an eye on? Are you thinking of changes in neurovascular status? If so, you got it. If not, comment on what you'd be looking out for as a nurse. I know that I'm thinking about what help or accommodations this client will need at home during their healing process. Okay, I think we've covered all things strains and sprains. Are you ready for a question? I sure am. Let's do it. A client states they twisted their left ankle while running. An x-ray reveals no fracture. The nurse provides discharge instructions to the client for treatment and recovery from their grade 2 ankle sprain. What symptom would be most critical to report to the provider? We have option 1, discomfort with weight bearing 1 week after the surgery. Option 2, numbness and loss of sensation in the left foot. Option 3, swelling and bruising remaining after a couple of days. Option 4, the pain has not improved despite time and rest, ice, compression, and elevation. Take a moment and pause here to answer the question. Come back when you're ready. All right, let's talk a little bit about the question before we answer it. This question is asking us to identify the option that is most critical to report to the provider. This is a priority question. Think about your ABCs, airway, breathing, circulation here. Anything stick out to you yet? Well, we know the client has an ankle sprain. So what would you be concerned about regarding sprains? If you're thinking numbness and loss of sensation, you got it. Numbness and loss of sensation could indicate neurovascular compromise, which requires further evaluation and treatment. Even though the x-ray was negative for a fracture, it is possible the injury was more severe than a sprain. Let's talk about the other options. Sprains may take weeks to resolve, depending on the severity. So it seems like we can rule out options 1 and 3 here, because depending on the expected length of recovery time, this warrants continued monitoring and follow-up. So it looks like we could take options 1 and 3 out, because neurovascular compromise would be a higher priority, looking at those ABCs. Pain that does not improve with interventions can be indicative of a need for further diagnostic imaging or treatment. While important for follow-up, it's not as critical as neurovascular compromise, so it looks like option 4 would be out as well. It all goes back to the bold word in the question, most. I love a good practice question. Thank you all for hanging around to talk about strains and sprains with me. Make sure you subscribe so you don't miss our latest video, and I'll see you soon.